we're really finding that as we do our outreach, we're really finding that there are many more members who are saying that they need help with accessing food, healthy food. We're finding that folks are asking for supports with job training, and places where they can get any kind of financial assistance. So we're definitely finding a lot more requests for these kinds of gaps in their supports, and which ultimately has a bigger impact on their health. So lack of nutrition is going to have an impact on their diabetes. That's going to have an impact on their mental health. So it's all interconnected. So unless we really are able to support them with these gaps, it's going to have a bigger impact on their overall healthcare.
And I know you mentioned briefly some of the services that Amerigroup offers, but can you just tell me what they are and what some of the programs are?
So, as I said, we've worked a lot on the digital health side of it to make sure our members can access these services on their own. We formed a partnership with Psych Hub. Psych Hub is a digital resource site that our members can access. Our providers can access it, and when you go onto Psych Hub, you can. There's like lots of material available, from suicide prevention to just coping on a day-to-day basis with your stress. So there's lots and lots of resources on Psych Hub that our members, providers, hospitals can all access and read this information. It's really self-help tools that they can use. We've also partnered with Aunt Bertha, which is like an online database. It's a tool that our members and case managers can use, and it's an online directory. It's a database of all community resources. So if someone wants information on job training, they can go to Aunt Bertha, they can enter their zip code, and once they enter their zip code and say, okay, they want information on job training, they can get free or low-cost organizations that offer that. Housing, food, access to transportation, you name it. All these community resources are available within Aunt Bertha, and we formed a partnership with Aunt Bertha for our members and for our case managers to be able to use this resource to be able to get the social supports that they need. We've also worked very closely with our providers to, as I mentioned earlier, to really increase access to telehealth services. We think that's really important. I think that even though the states are opening up, I think there are still people who are concerned about going to a provider's office to get their needs met.